Hello, everyone, and welcome to Question Lab. We're happy to have you here as we discuss tonight microbiology and dissect 4 questions on this topic. Leading our discussion tonight is Dr. Paras Vicaria, and he's going to introduce himself to you now. Paras.
Thank you, Sean. Hey guys, my name is Paras. I'm a current dermatology resident here in Dallas, Texas. I originally graduated from pharmacy school and then went back to do medical school after that. I'm also an RX coach with USMLE-Rx, so I work one-on-one with students such as yourselves to help prepare you guys for the USMLE Step 1 and Step 2 CK as well. And I'm happy to help lead tonight's session.
I know I mentioned RX coach earlier. What you should know for now is that the methodology we'll use as we dissect these 4 questions tonight on the topic of microbiology is similar to the methodology we employ in our coaching sessions. So with that, let's go ahead and get started with our first question of the evening. As always, the answer choices are covered up. I've removed them. That is by design. We do that because we don't want the answer choices to guide or dictate your thought process, and we don't want you to see an answer choice that you might be unfamiliar with, which may cause you to panic as you're trying to answer the question on test day. After that, we'd like to begin with the lead-in, which is the last sentence or the question itself. And the reason we do that is because we want you to know what the test writer is asking. This way, when you read that vignette, you can pick up on all those relevant clues and prevent yourself from having to waste time and reread that question on test day. So let's read that lead in now. Which of the following additional findings is most likely to be found on physical examination? Which of the following additional findings is most likely to be found on physical examination? I'll give all of you a few seconds here to respond in the question box and let us know how many steps you believe this question will require. An example of a 1-step question could be where you're asked for the diagnosis. An example of a 2-step question could be where you're asked for the treatment for a diagnosis. And an example of a 3-step question could be where you're asked for the mechanism of action for a treatment for a diagnosis. So I'll give all of you a few seconds here to respond in the question box, and then we'll move on to that vignette. All right, I see some responses coming in. Let's go ahead and take a look at that vignette. A 17-year-old boy presents to the clinic because of fever and pain and swelling on both sides of his face between his ear and jaw. He has recently returned from an overseas trip and was in contact with someone with similar symptoms. He has not received his routine childhood immunizations. His temperature is 38.8 Celsius or 101.8 Fahrenheit. Physical examination shows swelling and tenderness of the mandibular area bilaterally. Which of the following additional findings is most likely to be found on physical examination? I want all of you to start thinking about the important clues in the vignette and lead-in as I hand it off to Paras.
Thank you, Sean. So what we're going to do is we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in. And so starting off, they give us demographics. This is a 17-year-old boy. And so usually, a lot of these clinical questions are going to give you those demographics right off the bat. And so it's very important to make note of that because that can clue you in as to what's going on in this question. So you always want to make note of those demographics. And then they usually tell you, why are they coming to the hospital? Why are they at the ER? And in this case, they're coming in because of fever and pain and facial swelling, okay? A lot of times, they'll then also tell you how long it's been going on for, a few days, a few months, so you can get a sense to the chronicity of the problem as well. So you definitely want to make note of what brought them into the hospital and how long it's been there, okay? Now, in this question, they also give us some other important social history, okay, and some important physical exam and vital signs. You definitely want to make note of those, because that's together going to help you come to a diagnosis. So I think this question is then asking us about an additional finding, most likely on physical exam. So I think we've got a 2-step diagnosis here, or question. I think one, we've got to figure out a diagnosis. What is the problem, the condition? And then 2, what is an additional finding that we could see? So I think we have a nice 2-step question here. So let's go ahead and let's take a look at those answer choices. And as you see here, we have 5 answer choices. And what we recommend is that when students go through these answer choices, that they actually start at the bottom and work their way up to the top. And the reason we recommend this is because a lot of times we'll see students who start at the top and they'll see something they like, so they'll select it without having gone through all the choices. So sometimes they'll get that question wrong. So we recommend doing it this way to prevent yourself from making this mistake and prevent yourself from biasing yourself. So let's go ahead and do that now. Answer choice E, splenomegaly. D, peripheral edema. C, hepatomegaly. B, epigastric pain. And A, conjunctivitis. So we're going to go ahead and open up that poll. Go ahead and select the answer choice you think is the best answer here, and we'll talk about it in just a few seconds.
Excellent. Thank you, Paris. The poll is open. Once again, we're going to wait until about 2/3 of you have responded. Remember that there is no penalty for guessing on test day, so make sure you never leave a question blank. And if you're unsure tonight, don't worry. Take your best guess, and then we will review the incorrect and correct answer choices here in just a moment. I see the responses coming in. A few more seconds here. All right. Looks like we have a clear favorite so far. Let's take a look and see what you selected. So in number 1 place, we have splenomegaly with 35% of you selecting answer choice E. And in second place, we have conjunctivitis and 25% of you selected that. So let's take a look and see what the correct answer is. And the correct answer is B, epigastric pain. So definitely a tough question. Let me hand it off to Paris.
Thank you, Sean. Yes, definitely a tough question. So let's see what's going on here in this question. Well, if we take a look, we see that this patient has fever and swelling on both sides of the face between the ear and the jaw. So you want to think about swollen parotid glands. Okay, so swollen parotid glands, aka parotitis. Now this, in the setting of fever, should make you think about mumps. Okay. Now we also know that based on the fact that this patient has not had his routine childhood immunization, so did not get the measles, mumps, rubella immunization. Okay. Measles is caused, if we take a look at the next slide, this is taking a look at some of those manifestations of the mumps virus. This is a paramyxovirus, an RNA paramyxovirus. It's transmitted via respiratory droplets and direct contact. Okay. You can see there that mumps can present with parotitis, like our patient. Also orchitis, or inflammation of the testes, aseptic meningitis, and pancreatitis. So this patient could also have pancreatitis, one of the other manifestations of mumps infection, which could present as epigastric pain. Okay, so if we go back to our question and our answer choices, hopefully you guys are seeing why that is the best answer choice here. Okay. Answer choice C, splenomegaly, that would be a better option if we were talking about cytomegalovirus or viral hepatitis or infectious mononucleosis, but we don't have anything about a sore throat, lymphadenopathy. Okay. Peripheral edema, again, there are a lot of infectious causes of peripheral edema, but nothing really specific about that. Hepatomegaly, there are some infectious causes very similar to what we talked about splenomegaly, and nothing really there. And then lastly, conjunctivitis. This is if a patient were to have an acute viral infection with, let's say, measles virus. But again, with measles, we would expect a couple other things like cough, coryza, maybe a rash. So not the best answer choice here. So this kind of required knowing what the infection was, and that's mumps virus, and then knowing some of those other manifestations.
Excellent. Well, thank you, Paris. Great explanation as always. Let's move on now to our second question on the topic of microbiology. Once again, the answer choices have been removed. That is by design, and we will begin, as always, with the lead-in. Which of the following features characterizes the most likely causative organism? Which of the following features characterizes the most likely causative organism? I'll give all of you a few moments here to Respond in the question box and let us know how many steps you believe this question will require. I'll move on to that vignette. All right, let's take a look at that vignette. A 46-year-old woman is brought to the emergency department because of a 2-day history of dry cough, difficulty breathing, nausea, and vomiting. She is on immunosuppressive therapy following a kidney transplant that she received 2 months ago. Temperature is 39.4 Celsius at 103 degrees Fahrenheit. Pulse is 88 per minute. Respiration are 26 a minute. And blood pressure is 100/74. And oxygen saturation is 92% on room air. An X-ray of the chest shows bilateral, symmetrical, lower lobe, peri-bronchovascular, and alveolar infiltrates. Bronchoalveolar lavage is performed, and the results are shown. Which of the following features characterizes the most likely causative organism? Boris.
Thank you, Sean. So once again, we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in. Okay. So starting off, we now have a 46-year-old woman. Okay. And she is coming to the ER because of a dry cough, difficulty breathing, nausea, and vomiting. So imagine this patient's coming to the ER with those symptoms. And it's been going on for 2 days, so we are told a little bit about how long it's going on, okay? Now, they do give us some important medical history here, especially, we're dealing with the transplant patient. So patients with transplants are often on immunosuppressive medications, so you definitely want to make note of that. They give us some important vital signs, some imaging findings, and then a lavage findings there as well. Okay, so we want to make note of that. We want to try to incorporate what's going on there. And the question is asking us about a feature that characterizes the most likely causative organism. So I think, one, we've got to figure out maybe what's going on. Two, what is the causative organism? Those steps could maybe be tied together, but for clarity's sake, let's separate those. And then three, what is a characteristic feature of that organism? Okay. So maybe a 3-step question here. So let's go ahead and let's take a look at those answer choices. And once again, we have 5 answer choices. And what we're going to do is we're going to go ahead. Oh, actually, here we have a nice zoomed in image of that BAL, or the lavage. Okay, make sure you're taking a good look at that. And we'll go ahead and move on to the answer choice. And don't worry, that image will still be there. Okay. So we will go through those answer choices. Answer choice E, non-enveloped and double-stranded linear DNA. D, latency in mononuclear cells. C, formation of Langerhans giant cells. B, cysts with bradyzoites. A, budding cells with pseudohyphae. So we're going to go ahead and open up that poll. Go ahead and select the answer that you think is the best answer here. We'll talk about it in just a few seconds.
Excellent. Thank you, Boris. The poll is open. We'll give all of you a few seconds here to select your answer. As you noticed today, we're going over the correct and incorrect answer choices, and you should always do that when you're doing practice questions to make sure you got it right for the right reasons, but also because you can learn a lot from the other explanations as well. I see the responses coming in. We'll give all of you a few more moments here. All right. Well, let's take a look and see what all of you selected. 31% of you selected formation of Langerhans giant cells, and 24% of you selected latency in mononuclear cells. So let's take a look and see what the correct answer is. And the correct answer is indeed D, latency in mononuclear cells, and 24% of you got it right, so great job. Let me hand it off to Boris.
Thank you, Sean. So once again, we will go ahead and show you what we think are the important clues in this vignette and the lead-in. Okay. And so, we talked about how this patient is a middle-aged female, And we talk about how this patient has a history of a transplant, okay? So given that these patients are at risk of infections, and especially infections with kind of weird organisms as well, okay? Now in this situation, you know, they do give us a little bit of information, especially that lavage finding, okay? So if you look closely, you can kind of see that dark purplish, almost owl eye appearing finding kind of near the center of the image. And those are inclusions that are consistent with cytomegalovirus or CMV, okay? And this patient probably also has CMV pneumonia or pneumonitis. Okay, this patient has difficulty breathing, low oxygen saturation. There are some infiltrates in the lower lobes. Okay, so this is a concern. CMV infection is a concern in kidney transplant patients. Okay, and the findings there in that image would maybe point towards CMV. Okay, if we take a look at cytomegalovirus on the next slide, our nice little table from first aid, you could see that this is especially important infection in immunocompromised patients, especially pneumonia in transplant patients. Okay, these have the characteristic owl eye intranuclear inclusions, and they are latent in mononuclear cells. Okay, so there, hopefully you can see why answer choice D is the best answer there. Okay. If we go back to our question and the other answer choices, answer choice E, that would be getting at like an adenovirus, which is a little bit different. Formation of Langerhans giant cells, that would be more consistent with like a mycobacterial infection. Answer choice B, cysts with bradyzoites, that would be more consistent with something such as Toxoplasma gondii, okay? Those cause more commonly brain abscesses. And lastly is talking about Candida infection, which is more of a fungal infection, okay? So the best answer choice here would be D.
Well, thank you very much, Boris. I know I mentioned RX Coach earlier. I want to talk to you about it briefly now. You know, a lot of students call us and they say, you know, I'm studying, but my results aren't really matching my efforts, or I'm missing questions that I think I should be getting right, or I just don't know how to study. I don't know what to start, where to start. You know, if you're asking yourself any of those questions, or if you just want to do better than you're doing now, reach out to us and you can work with our coaches one-on-one. If you're studying for a board exam or a comprehensive shelf exam, we will administer our assessment, and then based on that assessment, come up with a personalized study plan and work with you to implement it, work with you to identify and bridge your knowledge gaps, and work on your test taking skills. You'll work one-on-one with one of our tutors and coaches like Boris or Brian. They're all highly trained and certified, and of course, you'll get access to all of our resources as a result. We've had some students go up as much as 80 points on the USMLE. We even have a coach right now that used to be a coaching student. We've had a lot of success with this program, and I think a lot of that is due to not only our wonderful team, but also the fact that we're the only tutoring and coaching program that was in medical education prior to starting coaching and tutoring. We've also authored our own resources. We have our own question bank. We have bricks, we have our videos, and we have our flash facts. We were created by the authors of USMLE, First Aid for the USMLE, and we have a lot of great data which we can utilize to help make your studying more efficient and really help you reach your peak potential. So if you're interested in talking about RX Coach and how it can benefit you, you can sign up for a free consultation or discuss the program at rx-coach or rx-coach.com. With that, let's go ahead and move on to our third question of the evening. Once again, the answer choices are removed, and we'll begin with the lead-in. The pathogen responsible for this neonate's most likely condition is also involved in the pathogenesis of which of the following neonatal diseases? The pathogen responsible for this neonate's most likely condition is also involved in the pathogenesis of which of the following neonatal diseases? I'll give all of you a few moments here to respond in the question box and let us know how many steps you think the question will require, and then we'll move on to that vignette. All right, I see some responses coming in. Let's take a look at that vignette. A 13-day-old infant is brought to the pediatrician by her mother because of red purulent eyes. The neonate's mother did not receive any medical care during her pregnancy and had an uneventful vaginal delivery at term. Physical examination of the infant demonstrates erythematous conjunctiva, swollen eyelids, and purulent discharge draining from both eyes. The organism responsible for this patient's condition is shown as a Giemsa stain in the image. The pathogen responsible for this neonate's most likely condition is also involved in the pathogenesis of which of the following neonatal diseases? Boris.
Thank you, Sean. So what we're going to do is we're going to go ahead and show you again what we think are the important clues in this vignette and the lead-in. And so now we've got a much younger patient, a 13-day-old infant, okay? And they're being brought in because of issues with their eyes, okay? Whenever you have these types of situations, especially with infants, you definitely want to take note of, what happened during the pregnancy. In this case, the mom didn't receive any medical care. What happened during delivery, okay? In this case, it was uneventful, okay? Now, obviously, the physical exam findings and stain there are also going to be very important, especially with the microbiology question. So you want to make note of those as well. Now, this question is a little bit more convoluted. It's asking about the most likely condition that this patient has, about the pathogen responsible for that, and it's also involved in the pathogenesis of what other neonatal disease. So I think we've got a couple steps here. I think one, we've got to figure out what this patient's most likely condition is. Two, what is the pathogen responsible? And then three, what other neonatal disease is it responsible or also involved in? Okay. So I think a three-step question here. So let's go ahead and let's take a look at those answer choices. And actually, first, we'll take a little zoom in on that slide so you guys can get a nice good look at that. And then we'll move on to the answer choices. Once again, we will start at the bottom. We'll work our way up to the top. Answer choice E, urethritis. D, pneumonia. C, otitis media. B, meningitis. And A, chorioretinitis. Once again, we're going to go ahead and open up that poll. Go ahead and select what you think is the best answer here. We'll talk about it in just a few seconds.
Well, thank you very much, Boris. As you can see, the poll is open. Keep in mind that we do have a raffle and a special offer, so make sure you stick around until the end because you must be present to win. I see some responses coming in. We'll give all of you a few seconds. Tomorrow night, we have our webinar with Dr. Tao Li on secrets to success on the USMLE. We hope you can join us. Same time tomorrow. Actually, tomorrow it'll be Dr. Urjan Iyer and Dr. Pars Vicaria hosting that session. All right, let's see what you selected. Looks like 32% of you selected pneumonia and 26% of you selected chorioretinitis. So let's take a look and see what the correct answer is. And the correct answer is D, pneumonia. And 32% of you got it right. So great job. Let me hand it off to Paris.
Thank you, Sean. Yes, great job on this question, guys. So let's take a look at what's going on here. So this infant, okay, is coming in with some issues with the eye. And this is a conjunctivitis, acute conjunctivitis. And the purulence and the time frame really points more towards a bacterial conjunctivitis, especially in a mom who didn't receive prenatal care, okay? Now in this age group, the most likely pathogen is Chlamydia, trachomatis, okay? Specifically serotypes D through K, okay? If we take a look at the next slide, this is looking at chlamydia infections in general. You can see there that Chlamydia trachomatis can cause in the first column, in the second paragraph, Chlamydia trachomatis can cause neonatal conjunctivitis, okay? And that's most likely what this patient has. And if we take a look even further, what we'll see on the next slide is a further look into the serotypes of Chlamydia trachomatis. It's always a little bit tricky when we start getting into these serotypes, but it is important to know. As you can see here, definitely fair game for a question. Now, if we look at the second row, types D to K can cause neonatal conjunctivitis 1 to 2 weeks after birth. And remember, our infant was 13 days old, so a little less than 2 weeks. You can see this can also cause neonatal pneumonia, like you guys picked up on, okay? That's why it's important. If you look at some of the other answer choices, if we go back to the other answer choices in the original vignette, you can see there that answer choice D, or pneumonia, is the best answer there, okay? So this type of serotype of Chlamydia trachomatis infection can also cause pneumonia, okay? Now the other answer choices, urethritis, you could think about more so in adults, not a neonate. And remember, this question asked about another neonatal disease, not just any other disease, okay? Otitis media, as well as meningitis, are not associated with this infection. Chorioretinitis is more so caused by toxoplasmosis. So the best answer choice here is answer choice D. And one of the other clues, if you look at that smear, you can see a little inclusion body in the middle of that cell, a little kind of hazy purple amoeboid-like thing that's kind of actually pushing the nucleus a little bit to the periphery, kind of in that cell that's right at 12, between 12 and 1 o'clock. And so those are the cytoplasmic inclusion bodies of this infection. So that's another clue that this is chlamydia infection as well. Okay, so a few clues here that you guys picked up on, so great job with this question.
Excellent, thank you, Paris. We've got one question left. Let's try to finish strong. As always, we will begin with that lead-in. Which of the following is the normal function of the respiratory cells affected by this patient's most likely condition? Which of the following is the normal function of the respiratory cells affected by this patient's most likely condition? I'll give all of you a few moments here to respond in the question box and let us know how many steps you believe this question will require, and I'll move on to that vignette. All right, I see the responses coming in. Let's take a look at that vignette. A 65-year-old man presents to the clinic with worsening cough, fever, and fatigue for 4 days. He has lost his sense of smell in the last day. He is febrile, and physical examination shows diffuse crackles. CT of the chest is shown. Which of the following is the normal function of the respiratory cells affected by this patient's most likely infection? Boris.
Thank you, Sean. So once again, we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in. And so this is the 4th time doing this. So hopefully you guys are starting to get a sense of what you think are those of what those important clues are, both in the vignette, but also the lead-in. As you could tell from that last question, some very important clues in that lead-in. So now in this case, we've got a 65-year-old male, and he's coming in because of a few signs and symptoms. You definitely want to make note of that, and you also want to make note of how long it's been going on for. There's also some other important history they give us, and some imaging and vital signs and physical exam findings as well. Okay. They're asking us about the normal function of the respiratory cells affected by the most likely infection. So I think we've got a few steps here. I think 1, we've got to figure out what is this most likely infection. 2, what respiratory cells are infected by that. And 3, what is the normal function of those respiratory cells? So I think we've got another nice 3-step question here. So let's go ahead and let's take a look at the answer choices below. Once again, we're going to start at the bottom and we're going to work our way up to the top. Answer choice E, transcellular gas exchange. D, secretion of pulmonary surfactant. C, phagocytosis of foreign materials. B, degradation of toxins. And A, antigen presentation to T cells. So we're going to go ahead and open up that answer you think is the best answer here. Talk about it in just a few seconds.
So we actually don't have a poll for this question, so if you don't mind, please respond in the question box and let us know what you believe the correct answer is. So once again, Please submit your responses in the question box as we don't have a poll for this question. I'll give all of you a few moments here to do that. All right, so some responses coming in. It looks like D is in the lead. It looks close. I'll give all of you a few more seconds here. All right. Give all of you a few more seconds just in case. All right, let's take a look and see what the correct answer is. And the correct answer is D, secretion of pulmonary surfactant. And it looks like D and E were our two most popular answer choices. So with that,
Thank you, Sean. What we're going to do is kind of explain to you what's going on in this question. So hopefully you guys picked up on that this patient may actually have coronavirus, okay? Dry cough, fever, loss of smell, okay? And if you look at that CT chest findings, you'll see that it doesn't look good, okay? And this is kind of consistent with what we see with COVID pneumonia patients, okay? You can see a lot of ground glass opacities and thickening. Doesn't look like good lungs, okay? Now, if we take a look at the next table, this is one of the nice new additions, is first aid actually kind of talks about this, okay? And it kind of talks about those symptoms you would see, how these patients can develop respiratory distress, okay? It also goes into a little bit of the virology, how it spreads, how it enters cells, okay? It attaches, as you can see there in the second column, host cell entry occurs by attachment of the viral spike protein to the ACE2 receptor, okay? And if we take a, one of the things about this infection is that it infects pneumocytes, okay? Specifically, primarily type 2 pneumocytes over type 1 pneumocytes, okay? So if we take a look at the next slide, now we'll kind of see what type 2 pneumocytes do. And we can see there that these help secrete surfactant, okay? So if we're damaging, or these type 2 pneumocytes that are affected by the COVID infection normally secrete surfactant, you can see how that can lead to respiratory distress. So if we go back to our question, you can see there that the best answer choice here is answer choice D, but that's after getting those first initial two steps of the type 2 pneumocytes and the type of infection this patient has. Now, the other answer choices are not really as relevant to COVID infection. Transcellular gas exchange is more common with type 1 pneumocytes, okay? But again, with COVID infections, it's actually type 2 that are primarily affected. The other answer choices have less so to do with pneumocytes. Answer choice C and answer choice A have to do with macrophages, so the alveolar macrophages. And then lastly, answer choice B, that has to do with club cells. So less involved in the pathogenesis of this infection. Great job on the questions tonight. Definitely some tough micro questions. I will hand it back to you, Sean.
well, thank you very much, Boris. Great job as always. These are the question IDs from tonight. So if you want to make note of these, take a screenshot or a picture. You'll then be able to type these into the RX search field and review them on your own time. So I'll give you a few seconds here to make note of these QIDs.